not going to take too much time because I'm really looking forward to having the dialogue and responding to the questions and hearing what are the issues on your minds. But I'll just say a couple of things in response to the presentation. First is that there's really not much I could say in disagreement with it. I'm certainly very much in support of what she said, because I do think that when what I call the first generation of health disparities research hit the scene, there was this focus on finding reasons for it, right? And the it was, first of all, comparing blacks and whites in health outcomes, right? And what we would say is, well, the reason that these differences exist is because of differences in access to care. You know, black patients don't really want to get care. We tell them what to do. They don't follow instructions. Even when they have insurance, they don't show up to get the care. You know, you've heard these excuses, right? All excuses at the individual level. Or, in the one that I've been battling against the most, which is the excuse that it's really about genetics or biology. You know, race differences in the biological makeup of different populations, and this is what's responsible for the disparities. How many of you have heard that one? Black men get a more aggressive form of prostate cancer. You heard that one? Right? There's a study that demonstrates that's not true. It's an old wives' tale. So this idea, or these ideas, that the source of the disparity is either something in the culture of the individuals or in the genetic code of the individuals. And I would argue it's not so much the genetic code, it's the zip code. So imagine, if you will, that you're a scientist in the 1600s, at the very earliest days of the founding of this country. And you have people coming to the shores of this country from different parts of the world. In most cases, they're coming here as indentured servants, which was the case for the first Africans that came to America as well. Let's say we did an experiment and we said, okay, we're going to pick one of these groups and we're going to let this group evolve normally, politically, socially, educationally, culturally. But we're going to take the other group and we're not going to allow this group to evolve. Right? We're going to put blockages in place that will provide, make it very difficult, if not nearly impossible, for this group to be on a normal trajectory in terms of its cultural, educational, economic, political evolution. And then 400 or so years later, we said, okay, the experiment's over. Let's see what happened. Let's measure the outcomes of the two groups. This measurement is published every year by the Department of Health and Human Services in a report called Health United States. It is the consequence of developing a society which provided for different levels of citizenship. In 1640, then Governor of Colonial Virginia, Sir Wyatt, by the way, I put his name out there, Thomas Wyatt, presided over a court hearing where 3 indentured servants escaped to Maryland from Virginia. They were indentured servants who owed 15 years of service. They escaped together. 2 were black, 1 was black, 2 was white. They committed the same crime, in quotes, crime. They committed the crime together at the same time and facilitated each other in carrying out this crime. They were captured and brought back to Virginia, and Sir Francis Wyatt presided over this case in 1640 and decided that the 2 white indentured servants would receive 15 additional years of service, and the black indentured servant would receive life in servitude. This was the first time that it was reified into law, formally reified into law, that you can discriminate against people on the basis of skin color. And clearly, in this perfect experiment, natural experiment, these people were treated differently because of the one difference between them. This is the natural experiment that we followed and that has become this country, and that is the source of this meeting we're having here today. What would happen if we were to identify communities throughout this country where black and white people lived together in integrated environments and there were no differences between blacks and whites in their income levels or educational levels? What would you find in terms of health disparities or health inequalities? Do you think they would have similar health outcomes, or would they be different? That wasn't a rhetorical question, by the way. Now, you know, when I lecture in class, I've been known to go, you know, first of all, I call on people. You know, I'll just call you out. And, you know, there was one time, students weren't paying attention. I decided to go stand in the back. They all sitting in the back. Went to the back of the room and lectured from back there. Made them all. So don't make me treat you like that. So, the question is, what would happen? What do you think would happen? So we've actually been doing that exact study. We've identified there are about 68,000 census tracts in the United States. Census tracts are smaller geographic units, smaller within cities, about 1,500 to 4,000 people, census tracts. 68,000 census tracts in the country. How many tracts do you think we identified that were racially integrated, fully integrated, with no race difference in income or education? 5? Well, you guys are jaded. You're worse than I am. 0. We found 425 census tracts that met that criteria. So we've been going to these communities and collecting data on people in these communities and asking the question, what is the nature of race differences in health when people are living under similar social and economic conditions? And we've been to one community so far. It's a very low income in an urban area in Baltimore City, where income there, median income is only $26,000, so that's very low income. And what we've been able to demonstrate so far is that we're not finding differences by race and health outcomes. No race difference in diabetes, rates of diabetes. No race differences in obesity rates among women. No race differences in smoking, rates of smoking. No race differences in physical activity. Now, this is a low-income, very challenged community. This is a community, I call this a sick community. Those of you that don't smoke, if you moved into this neighborhood, you would start smoking. Man, if I moved into this neighborhood, I'd start smoking. This is a sick place to live, right? So the equity, right, that we're finding there, or we should call it equality, not equity. The equality in health outcomes that we're finding in that community is not because the blacks in the community are doing so much better. It's because the whites in that community are just as sick as the blacks. They're all doing poorly. It's a sick place to live, right? So when you consider that the United States is a racially integrated country to the extent that we have many different races of people living in the country, but in fact, we live in the country, but we experience the country quite differently, because when you get inside the country and you look within the various communities, cities, states within in this country, there is tremendous racial segregation, right? So at the national level, it looks like we have this multi-ethnic country. But the reality is quite different. It's a very segregated country. So we're experiencing the country differently. We're more likely to have racial minorities, African Americans, Latinos in particular, Native Americans as well, more likely to live in communities that don't have safe, secure, and high quality sources of food, don't have access to care, health care when it is needed, don't have the ability to get jobs when, because there are no jobs for teenagers to get that first job, to begin on that ladder towards economic success. So when the minorities are more likely to live in these sorts of communities, and you take the national statistics that we often rely on, we're seeing the result of differences in the risk exposures that we have, differences in the types of communities that we have, not something about the biology of race. We recently did another study. We went to Canada, and we said, well, what do we find in Canada about disparities? Do you have the same race disparities between black and white Canadians? And we've had to pull together many years of data in Canada to be able to do this. What we've identified so far is that the disparities in Canada are either non-existent by race or far smaller than the gaps that we find in this country. So what's the difference between the United States and Canada? I used to live here in Maryland. I live in Maryland, I'm in Michigan now. I used to live here in Michigan. I spent a lot of time in Canada. So we cross that border all the time. What really is so different between the two countries?
Healthcare.
Healthcare? I think that's it. They have universal health care. Well, we have universal health care in the United States, too. We do. It's called the VA system, and it's called Medicare. And do we find disparities in the VA system? Do we find disparities in Medicare?
Yes.
Right? So where do we not find disparities in the United States? When people are living under similar socially and economically challenging conditions, we don't find disparities. We find everybody sick. The other place we don't find it is in the active duty military. Now, why would that be? Why would the active duty military not have disparities? Come on, class. Come on back. I know we're not in church, but you can give me some. Come on. Come on. Why is that?
In general, you treated the same.
Right. See, it's not the health care, it's the culture. You don't have black or white culture, you have green culture. So they're living in the same conditions, in the same environment, under the same rules, under the same pressures, and having the same health outcomes. So it seems to me that what we need to figure out is how do we bring the experiences of Canada and the experiences of the military into the broader society? How do we equalize the social and environmental conditions that people live under? How do we modify our society? How do we overcome the experiment that began in the 1600s? Thank you very much.